This video captures the highlights of the 7 modules that comprise the foundations of human services. This video on the 7 segments can be used as introductions to the accompanying training modules and learning guides available from the Bay Area Social Services Consortium. The modules focus on issues inside the organization, such as your role as a civil servant, understanding the components of providing quality services, the legislative origins of the social safety net, and the role of attitude, biases, and ethics, as well as issues outside the organization, such as the impact of health conditions, the impact of environmental conditions, and the impact of poverty on those we serve. This video is an overview of the training modules related to each of these internal and external issues for social workers, employment counselors, receptionists, bookkeepers, and other human services employees. Module 1. Working in a public social services department. Every day, in every community, there are individuals and families who reach out to public social services agencies for support to access food, housing, health service, and other resources. Often referred to as the safety net, these services, such as children and family services, adult and long-term care services, veteran services, employment and training, public assistance, and administrative and support services are available to all members of the community who qualify to receive them. Your job as a civil servant is to provide service in one of these areas as a representative of the county, state, and federal government. As a civil servant, you work for and are accountable to the public. While county social services agencies provide critical safety net services, they do not act alone. They frequently collaborate with other county agencies and nonprofits to provide additional support in the areas of nutrition and health services, parenting and counseling services, housing support, and substance abuse recovery, among others. Guidance on what programs must be provided and how their services must be delivered are determined in part by state and federal mandates. This guidance is provided to counties in the form of all-county letters and notices. These communications are then drafted into agency policy and procedures that direct staff in how to implement them. Other programs and approaches to delivering services are determined at the local or agency level. In this module, you learn about the role of public social services and how they fit within the larger county, state, and federal structure, and job roles and responsibilities, so you have an understanding of your organization and your role within it. Module 2. Introduction to Service Provision. Human services workers in public agencies have both the authority and responsibility for serving those who may be experiencing significant challenges. How they are treated can have a significant impact during a difficult time in their lives. Whether you are a social worker, employment counselor, receptionist, or bookkeeper, your role is to provide quality services that make them feel welcomed, listened to, and treated with respect. We create these feelings by looking up from our work and acknowledging the person requesting assistance, smiling when posing the question, "How can I help you?" and listening with interest. Effective and respectful communication enables us to capture critical pieces of information, make the client aware that they are important, and create positive experiences. In addition to being responsive to our clients' needs, we need to be aware of how culture impacts service delivery. As a human services professional, you will encounter people from a wide variety of cultures. These cultural differences are important to recognize while maintaining a non-judgmental attitude. Along with understanding cultural differences, it is important to appreciate that every person, regardless of their circumstances, has strengths as well as challenges. Providing strengths-based services means offering support to individuals with a focus on their existing skills, abilities, and assets. We do this by recognizing that every person has many strengths and the capacity to learn and grow, building upon that person's strengths to achieve the change they desire, actively involving them in decision-making, identifying and providing opportunities for them to be successful, demonstrating an understanding of the complexity of each person's situation and identifying challenges as well as strengths. Viewing others as unique and resourceful people who have the potential to achieve their goals is the first step toward working from a strengths-based perspective. In this module, we explore how to create a positive experience for those we serve, understand the role of culture in service provision, learn about providing strengths-based services, and discuss how to manage difficult situations. Module 3. Understanding the U.S. Social Safety Net. Public social services have a long, rich history in the United States. Begun as part of the settlement house movement of the late 1800s, with additional resources provided by faith-based organizations, services and supports to poor people first became an element of public policy following the Great Depression. Under the leadership of President Roosevelt and Congress, the first federal safety net program was established to help the elderly, vulnerable children, and families who were sliding into poverty. These federal programs included unemployment insurance, aid to dependent children, maternal and child welfare programs, retirement insurance, Social Security, and general welfare programs for indigent adults. In the 1960s, Medicare and Medicaid were added to the Social Security Act under President Johnson. During that same time, housing and food assistance programs were developed, and aid to dependent children was expanded. In addition, services were expanded to the elderly through the Older Americans Act, and to the elderly people and people with disabilities through the implementation of supplemental security income. In the late 1990s, the AFDC program was replaced with Temporary Aid to Needy Families, TANF, that had new requirements for work and a cap on the amount of time a family could receive assistance. Legislation in 1997 created the Children's Health Insurance Program, CHIP, and in 2010, the Affordable Care Act was passed into law, ensuring all Americans could have access to health insurance. These programs continue to this day, but are also modified over time. In this module and its related video, Expanding the U.S. Safety Net, you learn more about these important social safety net programs and see how they impact the ways we serve individuals and families in our work each day. Module 4. Attitude, Biases, and Ethics. As a human services employee, attitude is everything. Attitude is a way of thinking or feeling about someone or something that is often reflected in our behavior. Effective engagement with a wide variety of people with a range of life experiences requires a helpful, can-do attitude that expresses positivity and optimism, making us feel like anything is possible. At times, we make assumptions about people, perhaps based on the language they speak, the clothing they wear, the color of their skin, or their age. If the assumption includes a positive or negative judgment, it is considered a bias. Some of our biases are explicit or known to us. Others are unknown or implicit and operate outside our conscious awareness or control. Biases either for or against certain individuals or groups, however, can be damaging. For example, if a hiring manager believes that women are more compassionate than men, the best candidate might be overlooked if it is a man. Understanding and challenging our reactions can help us to avoid or reduce the chances of treating others unequally or unfairly. Remembering your role as a civil servant, you are expected to treat all people, regardless of your opinions or beliefs about them, with the same level of service, showing respect, and being fair. Many counties have their own code of ethics and conduct. Certain job roles have ethical guidelines tailored to a specific type of work. And there are standards that apply to all social services employees, regardless of position. These include maintaining confidentiality of all individuals at all times, avoiding conflicts of interest and the appearance of conflict of interest, following all laws, ordinances, policies, and regulations that relate to your work, and treating all individuals fairly, with respect, and without discrimination. In this module, we explore both how our attitude and biases, either known or unknown, impact our work and the ethics that underpin and guide our work in human services. Module 5. Health conditions impacting individuals and families we serve. Many of those we serve experience a wide range of conditions that impact their ability to function. These conditions include chronic health conditions, physical disabilities, developmental or learning disabilities, mental health issues such as depression or anxiety, and substance use, abuse, or addiction. For an individual living with any health challenge, successfully managing life's many details can be overwhelming. For someone who is experiencing multiple illnesses, co-occurrence, the difficulties increase, and they will likely require more support to participate in the services you provide. Whether you are working with someone with a chronic health condition, mental illness, or alcohol or substance use disorder, it may be hard for them to set and follow through with plans, maintain employment, manage family responsibilities, make good decisions, learn new information, and in some cases, control impulses. The most important thing you can do as a social services worker is to educate yourself. The more you know about these conditions, the more compassionate and helpful you can be as a service provider. In this module, you learn more about the various health conditions that may impact the children, adults, and families needing assistance and how best to serve them. Module 6. Environmental and social conditions impacting individuals and families we serve. The lives of individuals and families are integrally interwoven into their environments. A physical environment can be resource-rich with easily accessible grocery stores, good schools, parks and playgrounds, safe streets, adequate housing resources, and community services. Conversely, they can have poor schools, lack of outdoor environments, substandard housing, and poor access to services. The social environment of a neighborhood is determined by its physical environment, its residents, connections between neighbors, and the resources and supports available. In communities where there is distrust or a lack of cohesion among members, levels of stress are increased, negatively impacting health, mortality rates, and well-being. While these conditions exist in resource-rich communities, such as gated communities or those where neighbors feel isolated, the issues of distrust and lack of cohesion can have a more profound impact on resource-poor communities. Additionally, low-income and minority neighborhoods may lack social connections and political power, leaving residents unable to effectively address adverse conditions in their community. In contrast, in neighborhoods with stable social connections, the social environment serves to buffer the effects of stress and contributes to health and well-being. Institutions that promote social connection, houses of worship, social organizations, and community centers serve to strengthen social ties among community members and support individuals and families. Neighborhood norms may reflect cultural values. Culture manifests in many forms. As we work with an increasingly diverse group of individuals, we must seek to understand and learn about their cultures so that we may better serve them. For people of color and immigrants, racism and discrimination may have a profound effect on their lives. Their physical environment and the greater social environment may stand as obstacles to their ability to achieve success. Laws and policies at all levels have served to disadvantage many minority populations. People of African and Native American descent have experienced these disadvantages for generations. Successive waves of immigrants have each experienced some type of discrimination rooted in immigration policy and societal biases. In this module, we explore the impact one's physical and social environment, as well as racism and discrimination, have on the ability of those we serve to achieve success. Module 7. Understanding Poverty in the United States. Since the mid-1960s, the poverty rate in the United States has fluctuated between 11 and 15%, with 1 out of 5 children being poor. Poverty disproportionately impacts adult Americans, with Black and Native Americans and Latinos having the highest levels of poverty. Gender plays a role too. On average, approximately 13% of adult women experience poverty compared to just under 10% for men. By far, however, with their limited opportunities for employment, the group most impacted by poverty are people with disabilities, with nearly 1/3 of them living in poverty. Though a thorough exploration of the causes of poverty would reveal a multiplicity of factors, they may be understood as arising at 3 levels: societal, such as economic cycle, government policies, and social inequalities; community, such as access to affordable housing, high-quality fresh food, and affordable health care; individual and family, such as educational level and family composition, and physical or cognitive disability. In this module and its related video on understanding poverty in America, we explore the different ways in which poverty is defined, the causes of poverty, and reasons for optimism as we provide support and services to those impacted by poverty. As you can see in this video, working in public human service organizations requires all staff, whether you are a social worker, employment counselor, receptionist, or bookkeeper, to acquire a foundation of knowledge that has been briefly described in the preceding modules.